Hello, good morning. You're watching this, the Morning Star, coming to you live and direct from Star TV. Well, we're glad to be back, and we do apologize for starting up late because we should have started like sat 9, but for some reason, so we apologize for that anyway. Well, we're glad to be back, and it's the Morning Star. I am Shaggy together with Maimuna Jaju, who's my co-host. But this morning we're having a very important guest in the studio to talk about the vaccination week from the WHO. We're going to have this guest to have an exclusive interview with him. So we will definitely have to engage Mr. Nathan Bachaita to talk to us about the Africa Vaccination Week. But first, that's my colleague, Maimuna, how are you doing?
I'm doing good.
You all right?
Yeah, I'm fine.
Good. Mr. Bachaita, good morning.
Good morning to you and good morning, viewers.
Because of your busy schedule, so we are not going to keep you much longer, but we have to talk about something very important because I understand it's the vaccination week, and today is the last day of the vaccination week. Am I correct? But first, can you please take us through about the whole thing?
Okay, so Africa Vaccination Week is part of the International Vaccination Week.
Yeah.
And the idea behind this is that every year we choose a week in which to pay special focus on vaccinations, especially among children, because we know that vaccination, or PENGU as we call it here, is one of the most cost-effective public health interventions that has saved very many lives. By vaccinating children, we prevent them from we reduce their chances of getting certain diseases. And when they don't get certain diseases, it means that their chances of dying in infancy is reduced dramatically. But also it means that the parents who have to care for them are then free to do other responsibilities, because every time you have a sick child, a sick person in a home, it means that you are not able to do your regular work, your regular duties. It costs money to look. So if you can have something that can reduce certain illnesses ever happening in your home, then it's good. Now, this particular Africa Vaccination Week, our theme is immunization for all is humanly possible, meaning that if all of us put our heads to it, put our effort to it, and put in our all, it's possible to make sure that everyone who needs to be immunized at a certain stage in life is immunized. Now, this particular Africa Vaccination Week for us in the Gambia, I wanted today to focus more on the HPV vaccination. Now, HPV stands for human papilloma virus. Now, when people get infected with human papilloma virus, especially the women, then it increases their chances of getting cancer of the cervix. I hope you know what cancer of the cervix is, the mouth of the womb in women. So when you get our young ladies, young girls, aged between 9 and 14, you give them the human papilloma vaccine, virus vaccine, HPV vaccine, let's put it that way, before they get sexually active. It means that you have protected them from HPV, which is the most dominant route for transmission is sexual transmission. So if you can vaccinate people before they start getting sexually active, it means that should they encounter that vaccine, because they have immunity in their system, that virus, because they have immunity in their system, they will be able to fight it off and dramatically reduce the chances of getting cancer of the cervix.
How far have the acceleration process gone? Because I understand this year marks the midway point of the immunization agenda 2030. So talk to us about the acceleration process. How far have you gone so far?
Okay, we know that we have the immunization agenda 2030, and all activities, all public health interventions were affected by the COVID-19 outbreak because there was a decline in all of us. So what we're trying to do is to do a big catch-up to make sure that, one, the children who never got any vaccine at all, what we call the zero dose children, can go and get the vaccine. So we encourage parents that if your child never had a vaccine at all, please take to your vaccination center. But also those children who have had some vaccines but have not got all the doses they should have got by a certain age need to get these vaccines. So what we're encouraging parents is take your child with their card to the vaccination center and let the health workers there, they will know which vaccines you need to get, and you get them. While for the HPV, we've given it mostly through schools. So parents, discussions have been held between the Ministry of Health and Ministry of Education and the school management committees, and consent has been sought from parents. So your children most likely brought you a letter home and you had to consent to do that. Please let our daughters be vaccinated at the school, then we'll know that this is something we don't have to worry about and worry about other things.
There must be challenges in achieving that. What challenges have you encountered so far?
Of course, there are always challenges. One of the challenges we have is what we call vaccine hesitancy, because when we had the COVID-19 outbreak, there was a lot of information that came in. And some people wonder why to our daughters, why at this age? But I want to say that as WHO, one of our jobs is to identify public health problems and solutions. So when a vaccine is developed, it is vetted through very stringent measures. And by the time WHO recommends a vaccine, it means that that vaccine is safe and effective. So for those who are hesitant to take their children for vaccination, I would say this vaccine is safe and effective, and it has been shown that in countries where it has been scaled up to a large level, they have more or less eliminated cancer of the cervix. Women are getting other cancers, but not cancer of the cervix. So that can be our reality here. So vaccine hesitance is one. Sometimes it is issues like access to where the vaccines are. But I must say that the health system in the Gambia has ensured that people live within, most people, the majority of people live within a reasonable distance to a health facility, so can go there. But also there are measures that are taken for those who are hard to reach. Okay, so we have a community health system that makes sure that they go even to those who are hard to reach. So we have vaccine hesitancy and sometimes access, but these things are being addressed through education and making sure services are available.
So does that mean our health system has integrated vaccines into some of these essential services?
One of the beauties about the vaccination program in this country, and indeed in our region, is that it is integrated in primary health care. It's not a standalone, separate, vertical program. It's part of the primary health care system.
So do you have a specific age range for children who have to take the vaccine?
Most of the vaccines tend to be given to children below 1 year. Some go a little higher and so on, but tend to be that. But if you've missed any of your vaccines and you're below 5 years, so we focus on children who are below 5 years, and the health workers will be able to sort out and find out which ones you've missed. So we are focusing on children below 5 years most of the time. While for the HPV vaccine, it is the 9 to 14 years.
Yeah, it started from the 24th and today is the 30th. And I understand it's the last day so far. So what's happening today being the last day? What's so special about today being the last day of the vaccination campaign?
So on the last day, one of the things that we usually do is to try and look at the data, because before you launch out for a campaign like this, you know the numbers that you expect to receive. So one of the things that we've been doing progressively is to tally how many people have so far received the vaccine. So today they will be checking to see of the targets we set, have we achieved it? Where are some of the pockets where vaccination has not taken place so that they can be a mop-up campaign. Yeah.
Well, from the look of things, do you think you'll be able to achieve it?
Well, I think we are doing well so far. I haven't looked at the final numbers, but a number of people have turned up to, we've got very good reports from the field that people are coming. And if you're one of those who has not taken your child, this is your chance. It's still early today. I will still have a few hours. Please take your child and let them be vaccinated.
That is very important,
yes.
because you know, in this country we still have people who don't believe in some of these vaccines, that like kids need to take them, because to them, you know, they have this concept of the child having to go through some difficulties when he grows up or whatsoever. So it's important to talk to people so that they know the importance of this vaccine, that the child need to take it definitely.
Can I tell a story?
Yes.
Maybe this will illustrate this. Between 1985 and 1990, I was in medical school studying. Those were the years I was in medical school. So I started my clinical training in 1988. And I'm from Uganda. And at that time, in the hospital where I trained, we had a ward called the measles ward. And it was full of children who had come down with measles. By the time I was finishing my medical training in 1990, the ward was empty.
Wow.
And in fact, when a measles case would come, because we're final year students, they would call all of us and say, oh, come and see, a case of measles has occurred. And Uganda said, what happened between 1988 and 90? There was a scale-up of immunization and measles disappeared. You could hardly ever see measles cases. Unfortunately, in the last 5 years, we've seen a resurgence of measles. Measles has come back, especially among those communities or cohorts, pockets of people who resist immunization. They may be on cultural grounds, on religious grounds, or whatever grounds. We're even seeing highly developed countries getting measles outbreaks because of having a cohort of people not vaccinated. Another thing I can give is that growing up, we had people who had polio, because polio had no, so you would get people who had been debilitated, crippled by polio.
Yeah.
A time came when you could hardly see. In my clinical practice, mine, and I've been a doctor for more than 30 years, I've only ever seen 2 cases of polio, 2. There are some of these vaccine immunizable diseases like diphtheria, pertussis. I've never seen cases of those in my clinical practice. They all disappeared. In other words, we can make certain diseases history if we vaccinate.
But I can see here in the African region, they've recorded 93% decline in circulating variant polio virus type 1. Is it still 93, or the number is higher than 93, or it's below 93 now?
Well, circulating vaccine-derived polio virus arises as a result of mutations that occur in the vaccine that we give to people. So a reduction means that, so we've seen a reduction, but we still get some cases coming up, because you can't predict where it will happen. A child is vaccinated, and then the vaccine, because once the child is vaccinated, they shed that vaccine in the environment, and it may infect some people, and then it undergoes mutations until it can cause disease and so on. So there has been a reduction, but what I would say is that there are good surveillance systems that have been put in all the countries, either through surveillance, people going to the field, but also through environmental surveillance, so that we are able to pick it up should it arise. Like one was picked up in the Gambia recently, and then we had mass vaccination against polio. So the reduction is real, but we know that we want to come to the very final one. We don't know when that will be, but surveillance systems are there to pick it.
That's nice. I know time is up. We're taking much of your time. You have another engagement, but before I take leave of you, I want to know, what the WHO want to achieve before 2030. That is the immunization agenda 2030. What are your expectations?
Our expectations is that, first of all, this agenda is not for WHO, it is for all of us.
Yeah.
WHO just happens to be the technical agency. What I would say is that if all of us participate and play our role, that is the politicians, the technicians, that is us, and then the population, the communities, the religious leaders and so on, we can achieve that agenda by making sure that we let our children get vaccinated, get the full complement of vaccines that is required, and then we could be able to achieve that agenda. There are challenges because you have to invest financially, you have some of these hesitancy issues and so on, but there is hope that it can be achieved.
And domestic investment too from the government.
Of course, and let me say that domestic investment is critical because, let's face it, yes, as partners we do support this, but it's government which builds the health facilities, it's government which pays the health workers. So indeed they have invested in this and also put in some of the money for the vaccine. So there is a lot of government investment in achieving this.
Thank you. You have another question, Maimuna?
We're good to go.
Okay. What else would you want to say before we take leave of you? Because I don't want to keep you here that long.
So what I want to say, my fellow Gambians, I'm now one of you. Let us take our children to the vaccination centers. And for those who have daughters, make sure that you grant the permission so that they receive the HPV at the schools, so that we can say bye-bye to vaccine preventable diseases. So go for your pengu in time where you're supposed to go,
I like
so
that. Go
that
for your pengu.
we can say bye-bye to these diseases, and Gambia will be focusing